And our last submission for today is the Canterbury and West Coast branch of the Public Health Association, Rachel Eyre, and I think, Rachel, you've got somebody else with you as well.
I'd like to introduce Lee Tookie.
Hi, Lee.
Tēnā koutou katoa. Firstly, I'd like to acknowledge you all, councillors, mayor and staff. It must feel like a very long day. We're the lucky last. Thank you for the opportunity to talk to our submission. Lee Tookie is the chair of our Public Health Association Canterbury and West Coast branch, and I'm a committee member and past chair. So first I'd like to talk a little bit about our organisation, who we are, and then just talk to three main themes of our submission so that I don't waste your time this evening. And the themes are equity or fairness for all, healthy environments, and future focus. So first of all, the PHA is a national organisation. We've submitted to the council many times before. We have local branches around the country with a diverse membership. In our day jobs, many of us are health professionals working to improve the health of communities, and we contribute to the PHA in a volunteer capacity. So for example, I'm a qualified public health specialist and I'm here on my day off, and Lee works for Healthy Christchurch and also works in workplace wellbeing at the DHB. So as PHA, we're mainly concerned about improving the conditions of health and wellbeing for the most vulnerable groups in society. And we seek to be a strong, informed and influential voice, both from an evidence-informed, research-backed perspective, but also from a values perspective in taking equity as a strong standpoint. Issues of child health and poverty, housing and climate change are among our top priorities. And we see that local government has a huge role to play in shaping the conditions of health and wellbeing for communities. Healthy places create healthy lives. We also see that the rebuild creates a unique opportunity for health to be given explicit consideration, both from an urban design, but also from a community psychosocial recovery perspective. So I'll now move quickly to our three themes. The first concerns the council's need to safeguard equity or fairness for all. We acknowledge the challenge this council faces with the first 10-year plan in the aftermath of the earthquakes and meeting the costs of a massive infrastructure repair and rebuild with uncertain revenue. On the whole, we understand the rationale for the balanced approach the council has taken. However, we are really concerned about the impact of future rate rises and the costs increase of everything on poorer individuals, families and communities. So firstly, we urge the council to really look at the expenses part of the balance sheet and think about the big ticket items such as the anchor projects and question who will benefit and who might not. For example, it would be awful to see the community suffer death by 1,000 cuts so we can have, for example, a splendid convention centre used for a handful of events per year, but not accessed by many of our residents. All the more galling when the community was never consulted about these anchor projects in the first place. So we would support you to go back to central government to renegotiate these anchor projects, their number, scale and timing. We'd also like to see more consideration given to expanding rate rebate packages, and not mentioned in our submission, but an idea well worthy of consideration is the introduction of a local complementary currency for Christchurch, as suggested by Councillor Rav Manji, which could be used to pay a portion of our rates. We don't want Christchurch citizens paying for things they didn't want, with a diminished ability to afford essentials like power to heat their homes or food to provide an adequate healthy diet or for doctors' visits. The second theme is the council's ability to shape healthy environments. And we've made a number of recommendations in our submission about how you can create a healthy environment at relatively low cost. Again, if health is given explicit consideration. Firstly, I'd like to mention tobacco. And you will have heard from Smoke Free Canterbury earlier today, whose submission we support. Communities and central government at large support the goal of a smoke-free New Zealand by 2025. And currently tobacco is the biggest killer, soon to be surpassed by obesity. And we commend the council for supporting smoke-free social housing and for extending the number of smoke-free public spaces. This establishes smoke-free as the norm for our young people growing up and supports an increasing number of ex-smokers to remain smoke-free. We hope you will continue to be a strong partner with Smoke Free Canterbury and applaud your leadership. Similar examples on how council can create healthy environments apply to alcohol and obesity.
Can we not do alcohol?
We won't do alcohol.
Great.
For obesity, we want to see the cycleway projects completed as soon as possible.
Yep.
We want to see a truly integrated approach to travel planning around our city that includes both active and public transport options to all areas. And housing is another healthy environment that's critical to health. We support the council's move to encourage energy efficiency and warmer homes through initiatives like WAFs on rental housing, and like to see wider use of the Build Back Smarter programme to promote energy efficiency. And we want to see the council retain its level of involvement in social housing provision. This is a very important safety net for our community. Our last theme is future focus. The Lancet Commission, a well-respected health group, has described climate change as the biggest public health challenge we will face in the 21st century. How will our communities learn to live with lower emissions and be resilient to the impacts of climate change that are already assured? When I moved to Christchurch with my family in 2010, I was very excited to be moving to a city which had just launched its climate smart strategy. I saw Christchurch as a progressive place that was future focused and a place where I wanted to bring my children up. A place that wanted to be part of the solution and not part of the problem. Post-earthquake, I would hope the council can still hold to this strategy and the need to move swiftly to a low-carbon future that we all depend on. We already know what sea level rises mean to Christchurch. We've had a taste of this with the regular flooding in parts of our city where the land levels have dropped post-quakes. And we know about natural disasters and the impacts on mental health and general social disruption. With climate change comes the increased frequency of adverse weather events, and this has health consequences. For example, during hotter weather, we see more admissions to Christchurch Hospital from diabetes. We applaud the Mayor's oft-stated commitment to resilience, and this includes food resilience and community resilience too. So we argue that the climate smart strategy should overarch and shape all the other plans, including this long-term plan. Council needs to consider carbon reduction in everything it does. The future will not be a continuation of the past. We also need to ensure a just transition to a low-carbon future where equity is built in, so our least well-off are not further disadvantaged by any changes. Finally, we congratulate the Council for being future-focused through its Clean, Green, Smart District Energy Scheme, for divesting from fossil fuels through Christchurch City Holdings, and for declaring itself frack-free. The health of our environment and the health of people are inextricably linked, and the future is being shaped through this 10-year plan now. Thanks for creating a healthy city for now and the future for all of our sakes. Thank you.
Thank you. Phil.
Thank you. Just on, you've got a question here about the district energy scheme. It is well underway, and I'm sure I'd be happy to talk with you and staff would too. And there's a development too with Christchurch Hospital, them being part of that scheme too. What I wanted to ask you about is housing, and it's sort of like thank you for your support for us around that. And I just wondered if your association might also talk with the DHB around forming a partnership with us in our social housing, just so we actually have that conversation, and maybe you people could be part of that. Because clearly, like a lot of health patients, mental health patients, clients particularly, benefit and need our social housing. So
This is the Public Health Association.
Yes,
Yeah,
I'm just
we're
wondering,
not part
I'm wondering,
of
is
it.
They're
that
not,
something
they're not part of the DHB.
No, I know.
Yeah.
So
Okay.
I'm just wondering, is that something that
Yeah.
you could also talk to the DHB about?
Well,
Yeah.
Lee is a member of the Canterbury DHB, and we're also in a workplace that has experts around, has housing expertise.
Yeah. And
in
I'm a
fact,
former
that,
member.
yeah, that housing expertise actually fed into this, into our submission. So really happy to take that suggestion back.
Yeah, thank you.
Yeah, thank you.
Yeah.
Yeah, okay. I just did a mental block. Yanni.
Yeah, thank you. Look, thank you for your very detailed submission. I look at page 136 of our book, and point 5, you say you applaud the council's commitment to developing cycleways and the accessible city projects, and you want those to be a priority and completed within the timeframes.
Yeah.
Just if you separate the cycleways from the accessible city,
Yeah.
we're proposing to spend 160 million on central city roading projects on top of all the earthquake repairs. And when I hear the kind of tone of your submission, one of the things that comes through really strongly is how do we address the inequality that happens? So I just wondered why you think that that's a priority, like, you know, the 16 million for Kilmore Street for 5 blocks to two-way it.
Yeah.
And then I kind of wonder whether, in order to give effect to what you're asking for, whether you
Yeah.
think there's a real need to do a social impact assessment, which I haven't been able to find a single one done in terms of the recovery or the blueprint.
Yeah.
But is that something, it possibly is a tool to understand
Absolutely.
where the priorities should be ahead of those expensive central city transport projects?
Absolutely. I think you're absolutely right. In terms of looking at where, you know, where the current issues are. I mean, I've heard some of the other submissions here about children who can't scooter to their school, you know, and in some areas it's really broken. And I think why are we not prioritising those places, you know, for simple everyday activity? Children should be able to cycle and be able to scooter to their schools in the low deprivation, you know, the higher deprivation areas as much as the lower deprivation areas. So I think a social impact and a health and social impact assessment is just the kind of thing that would be really helpful to drive where the priorities should be.
Yeah.
Yeah.
Fixing the footpaths on the way to schools would be a good place to start. But look, thank you very much. That's come to the end of the day, and I wouldn't say, but what I would say last, but certainly not least, very important submission to hear from the Public Health Association, and really positive note to end on for the day. Thank you very much.
Thank you.